Physiotherapists often have questions about supervision requirements when they are performing restricted activities. Direct supervision is required anytime a physiotherapist in turn is performing suctioning, reducing a dislocated joint, performing wound debridement and care, or performing pelvic health internal examinations. Direct supervision is also required anytime a physiotherapist on the general register is learning how to order diagnostic imaging, perform pelvic health internal examinations, perform spinal manipulation, or use needles in practice. Direct supervision means the supervisor is present, in the treatment cubicle or room, able to observe the supervisee's actions and stop or redirect them if needed. Supervisors must be a PT on the general register and be competent and authorized to perform the activity. Why aren't you meeting supervision requirements?
I didn't know that was required.
I'm eager to add these skills to my practice. I don't want to wait.
It takes away from the booking slots I have for patients and causes lost income.
I thought being nearby was good enough.
With other supervision, you can transition from direct to indirect. Why can't we do that with restricted activities?
Supervision requirements for restricted activities are established in legislation and the standards of practice. Due to their risks, there is no flexibility to the requirement for direct supervision and no option for the supervisor to use their discretion. Remember that these are high-risk activities. The supervision requirement is in place to make sure that clients receive quality, safe, effective physiotherapy care when that care includes performance of restricted activities. Failing to provide appropriate supervision could end up being very costly to the patient and the physiotherapist involved, especially if it results in unsafe care or a patient safety incident. Being unaware of regulatory requirements is not an acceptable defense if a patient safety incident occurs or a patient makes a complaint about your practice. Now that you know better, how will you change your practice? If you have questions about your supervision responsibilities, call the college's practice advisor.